Now, WION has been tracking each and every development of this coronavirus epidemic since day one. And to get the sense of ground zero, we have collaborated with China's CGTN. And so we have CGTN correspondent Jarchine Zhou joining us live from the epicenter of the outbreak, Wuhan. Jarchine, thank you so much for bringing us this live update. Talk to us. The number of deaths due to this epidemic in China have surpassed that of the SARS epidemic. How was the situation on the ground in Wuhan at the moment?
Yes, thank you for having me. First, I have to remind that among those who passed away, mostly are the elderly who are more vulnerable to the coronavirus. However, the young group are likely vulnerable to the SARS back in 2003. And doctors told me some senior people may have complications. And the coronavirus, pneumonia, triggered the death, I have to say. And talking about situation here, Hubei authorities on Sunday issued a notice on the battle against deadly coronavirus outbreak, saying that it will enhance the isolation and treatment for patients with symptoms suspected of being affected with the coronavirus, as well as those in close contact with the infected. According to the notice, hotels, guest houses, and other buildings in proper condition will be requisitioned as quarantine areas for patients. And given the potential for human-to-human transmission, there is no public transportation yet in Wuhan, as local authorities suspend all forms of those transportation, including outbound trains and flights. And you really see people walking around now. But yet, on the streets, you can see trucks and taxis carrying supplies and medical workers, as well as private cars delivering daily necessities. And the public is following advice and remaining indoors. And shopping malls, restaurants, and cinemas that are usually busy during this period, as you mentioned, the Chinese Lunar Year, are all closed. But it's a very different story for the hospital there, as you say, that where medical staff have been working around the clock and are in dire need of resources. And over the past weekend, actually, we've seen 60 medical teams arrive in the city, featuring 6,000 personnel. And this includes the teams dispatched from the military.
Right. Jarchine, I want to talk about the speed-built hospital, which has become operational today. How much rush or otherwise it is facing?
The newly built hospital, which hosts 1,000 beds, is open to patients today, and thousands of workers have been racing against time to finish it, as what Chinese Premier Li Keqiang urged a safety island for the patients. And during Li's visit there last week, he ordered to use every possible means to admit all the patients into the hospital. Yet the makeshift hospital and another parallel one, which will provide more 600 beds in response to the increasing number of patients, are being finished in about a week. And works need to be done, and systems for water, power, heat, and oxygen supply are just nearing completion. And the furnishing inside and outdoor medical treatment are underway. And meanwhile, we learned that some 1,400 military medical workers under the deployment of the Central Military Commission, chaired by Chinese President Xi Jinping, would join the battle there. And the medical task force would join the medical relief on patients and work in different sectors, including infection control, which is now considered the most crucial part. And worth mentioning, the container wards there are negative pressure rooms that are set to prevent the air outflow. And the Chinese telecom giant Huawei is also working with Chinese telecoms to provide a remote diagnosis in terms of better medical professionals in other cities and the virus situation in Wuhan.
Jarchine, Wuhan is still under a lockdown as we speak. Talk to us about how people in Wuhan are coping with day-to-day life over there.
Yes, the situation escalated ahead of the Chinese New Year, when hundreds of millions of people travel to reunite with their families. And thus, during this period, many families, if you know that, have food in store ahead of time. I walked to a supermarket the other day, and most of the citizens are buying vegetables, which the manager told me that the government is taking every possible means to assure the supply, as well as the pricing. Differently, there has been no outdoor entertainment over the Chinese New Year, which is absolutely unprecedented. And the traditional holiday was extended now by a week, but many non-essential sectors have now prolonged the holidays even further, and people have been advised to work from home. The people I've spoken to in that supermarket support the move, and they say that the main priority now is to help curb the spread of the virus. And I also spoke to a French woman there who is married to a local and has been living in Wuhan for a couple of years. Interestingly, she said that the only difference it made to her life is that it's been much less crowded over the holidays.
All right. Any new breakthrough in terms of the development of a new drug or vaccine for this new coronavirus?
Yeah, there are no official announcement of any drugs curable for the coronavirus-related pneumonia. The National Health Authority said this afternoon that there might be medicines, including Chinese traditional herbs, in developing as more clinical data needs to be connected before going to the market. So it also said that the agency will also develop medical solutions in terms of different stages of the coronavirus development.
And how are the medical staff coping with this kind of extreme adversity?
We've known that there are medical workers who are also infected by the coronavirus, and most of them have to stay in the ward about 4 hours. And for the virus-hit city in dire need of medical workers, a nurse there couldn't afford an infection. And I interviewed a nurse who was infected during her work, and she was discharged on Saturday and will undergo another 2 weeks of observation. She tore up in front of me when she recalled having to be treated by others in the hospital. And she said her nurse fellow had to be on the front line, taking on the challenges and wearing, the heavy protective suits every day. But after all that she's been through, she became grateful and assured, saying more medical teams are coming to the city, especially the military medical teams, and helping the city recover. Another nurse that I spoke to quarantined herself at home for a week after she thought she had to, meaning that she was unable to breastfeed her 6-month-old son. Fortunately, her husband got help from some breast milk donor through the social media. And after receiving these support, that the man said that he felt there is power in unity and love. So amid the crisis, there are always touching moments in this virus-hit city.
Jarchine Zhou of CGTN joining us live from Wuhan. Jarchine also talked to us. There is also this rising trend of public sentiment that's turning against people from the Hubei province and Wuhan. Comments scolding them have been found on Weibo. How exactly is that situation shaping up?
I have Wuhan friends, actually. Most of them are very friendly and kind. I think this is a situation that the whole nation should stand together to deal with. So we know that there are a lot of rumors or, dissatisfaction against the Red Cross. So we understand that. So that's the reason why we should now come to realize that it is not a big challenge, but at the same time, as President Xi said, that after his approval of the military medical workers coming to the city, most of the people are feeling that there is a confidence. I think this, especially when I talked to one nurse that recovered, she believed that her experience would share the inspiration with patients, and at the same time, I will see that more doctors and more nurses, more patients are coming out from this battle and pass this positive energy to the whole nation.
Jarchine Zhou of CGTN joining us live on this broadcast straight from the epicenter of the outbreak, Wuhan city in China. Thank you, Jarchine, for taking time out to be with us here on WION The World as well.